So let's start with what you like, and when it comes to like filler, Botox, and surgery, because I will tell the audience, they know I use Botox, but I am very anti-filler, very anti-filler. It just goes wrong too often.
I think like anything, it really comes down to a little of something can be a really good thing, but when you find a little of something is a good thing, then plastic surgeons go haywire on it and becomes a bad thing. Back in 2004, I was one of the co-authors of a seminal paper called the volumetric facelift. And this was a paper that was one of the first ones that described that our face ages in 3 dimensions. As we get older, it's not just that things sag, but we lose volume. And so my mentor out in Beverly Hills at the time taught me how to do fat injections. And this was before fillers got popular or any of that type of stuff. And if you do it in a very conservative fashion, same thing with fillers, it can look really nice. But unfortunately, that's not what's going on now. And you see Real Housewives and these celebrities out there, and it's pillow face mania. It's just too much.
Yeah, they make themselves look fat, and they haven't fooled me about their age either. So now you're old and fat. Like, why don't you just pick one? At least you could be old and skinny.
Problem is you get somebody who's in their 20s and they get a bunch of filler, and now they look like they're somebody in their 50s who's trying to look like they're in their 20s.
Yes.
It backfires.
And it's weird. It's like, this is where everybody gets it, right? The nasal labial folds.
Nasal labial folds, yeah.
You look weird if you don't have lines there when you're I'm 53. If I didn't have any line there, you'd be like, I guess you got a bunch of filler inject. Like, it just looks like some lineage
even babies
is expected.
Have those. Yes. And even babies have lines here. And yes, we do get patients who come in, they say, I just want to obliterate this line. And it's like, no, it doesn't look right. And it looks stiff, and you smile and it looks stiff and not right. I think, the way I look at filler, and filler is the number 2 most popular cosmetic treatment, is to use it very sparingly, ideally up in the cheek areas, because we do lose volume there, and adding just a little bit of volume can make a big difference. But filler also, unlike Botox, Botox, the worst thing that happens if you get Botox is maybe you get a crooked smile, or your eyebrows look kind of funky for a few months, and then it wears off. There's no permanent effects. But if you get bad filler, not only can you look weird, that's actually the least of it. There are people who've had filler and they've lost parts of their lips, parts of their nose, they literally necrose, they turn black, they fall off, and people have gone blind from injections of filler. So you really want to be careful with how you have it done and who does it. And there are certain very simple things to make sure. Number 1, make sure it's a hyaluronic acid filler. That's a type of filler in Restylane or Juvederm. If you get a complication, you can actually melt it away. But there are other fillers out there that you can't melt away. And if you get what we call an intravascular occlusion, where they inject that filler accidentally into a blood vessel, basically you're screwed. You can lose parts of your nose, and lip turns black and falls off, and it can be disaster.
All right, ladies, listen to me. Get the lasers. Get the Botox. Ask your doctor about the order, because I don't know, in some things you're not supposed to have those too close to each other. I don't know how it works. I don't believe in the filler. Get if this is what I do, and it allows you to age, but age well, and you don't look weird and desperate. Like I've seen, I'm not going to name names, but so many people in my business on television news overdo the filler. They overdo the Botox too, and they just look like freaks. And now the latest thing is the lips, Doc, and the lips. Okay, I guess I don't like that. Doug's like, don't ever touch your lips. But if you want to get your lips done, okay. But everyone, they're going for the Kim Kardashian. I don't know how she did. She made her lips look really big and flat. But what happens with most people is they stick filler in there and their lips stick out like a ledge, like you could put your teacup on there. And so what's happening?
So traditionally, when you inject the lips, you inject along what's called the vermilion border. And that's the part where your lip and your skin meet. And so if you inject along that vermilion border, what you're doing is you are outlining the lips. And that's what you're talking about, is kind of a ledge in that area. I'll tell you, getting your lips done is the most painful thing ever. Like, I hate doing it, and I do it occasionally, but I hate it because I feel so bad, because it hurts like you wouldn't believe.
My friend told me that. She said she tried to leave after one quadrant, and the doctor was like, no, you have to see it through now.
I had one patient, she came in, she was in her 60s with her husband, God bless them, and she just wanted to get her lips done for her husband. And every time I would stick the needle in, she'd start screaming like, dear God, Lord, thank you, dear God, please help me. So then I kept stopping, And then I go, are you sure we can just stop? She goes, no, I'm doing this for my husband. He wants these lips. And her husband's like, no, honey, it's okay. You don't have to do it. She's like, do it, doctor. So I inject her again, like, oh, dear God, Lord Jesus in heaven. Oh, it was the most screaming I've ever had in my office in 20 years. And we did get through it, but it hurts.
That's not worth it. Unless you have no lips. There's some people who have no lips, like Frank Burns on MASH. I remember he had no lips. Then I get it. But like, if you have normal lips, this is a weird fad we're going through. We're really hurting ourselves. And I'm not sure about those injections.
One little simple thing. Okay, two things that you can do. One thing is there's something called the Botox Lip Flip. So if you're getting a little Botox, if you take just a couple of units and put it at your Cupid's bow, which is a part of your lip that kind of comes up, two little points here, then it will actually cause your lip to evert a little bit and cause your upper lip to look a little bigger. So if you want to try something with the lips, that's an easy thing to do. Otherwise, there are a lot of topical lip plumpers out there, or you can even make your own. You take your normal lip gloss, and you get some food-grade peppermint oil. You put a couple of drops in your lip gloss, mix it up, and then apply it to your lips. That peppermint oil will create a little bit of a tingling sensation, and it can create a little bit of irritation to cause your lips to look a little bit bigger. It may last an hour or two if you're going out to an event or on a date. By the time it wears off, hopefully the date's long gone or your reunion's over and people wouldn't be any the wiser.
All right. Now, why? I understand the Kardashians deny everything. Okay, that's on the record. Why are their lips, in your estimation, so big and flat? Like they don't seem to have the ledge. They seem to have done something else. Almost looks like there's an implant in there.
There are implants that are being used, but they're not used often. I believe, and I'm not her doctor, so this is just my opinion, that there are certain celebrities like Meg Ryan, I believe, who may have had one done in the past, just my opinion. But with the Kardashians, I do believe it's mainly filler, but it's filler that's not just injected along that border of the lip, but it's injected through the meat of the lip as well. And there are fillers nowadays, too, that are much finer than the other fillers that, let's say, you'd use for the cheeks. They're going to look and feel much softer. But I mean, I don't know the Kardashians. My guess, though, is that they probably wouldn't pass the kiss test. The kiss test is something that to test whether you've had good lip filler, and that if you kiss somebody who has lip filler, if it feels like you're kissing a spare tire, then they have failed the kiss test. And unfortunately, probably didn't get a great job.
As we approach another critical election, many Americans are concerned. Recent studies reveal that an astonishing 56% of citizens report feelings of anxiety or dread about the upcoming election. But I want to tell you about AMAC, the Association of Mature American Citizens. AMAC is more than a senior organization. During these challenging times, they fight for common sense and for the U.S. to return to traditional American values. Visit amac.us/Megyn today to get an exclusive election year special. That's a 4-year AMAC membership for just $30. As an AMAC member, you not only enjoy money-saving benefits, but also the AMAC magazine, free Social Security and Medicare advice, a trusted voice in Washington, and a community of like-minded patriots. Take advantage of this election year special, 4 years for $30, and be part of the solution. Join now at amac.us/Megyn. That's amac.us/Megyn. Hey, thanks so much for watching. If you like what you just saw, hit the subscribe button for more clips and full episodes.